Hello, everyone. Welcome to this webinar. We will just wait for 1 more minute and then Ola will get us started.
Good morning, good evening, good afternoon. For our participants, thank you very much for taking the time to be with us today. We really believe that our discussion in this webinar is really very timely. It comes along the 3rd of December, which is the day we celebrate the rights of persons with disabilities, but also it comes around the week of the Conference of State Parties discussing the progress around the Convention on Rights of Persons with Disabilities. Equally, this pandemic reminds us of the huge importance of mainstreaming disability within the health system, policies and regulations and services. And that's why our discussion today, hopefully, will promote further thinking, action, and future reminder that this is something that can't be missed anymore. So we welcome everybody on behalf of the initiative. And we look forward to debating and discussing with you in the coming hour. On the webinar, our panelists are myself, Alghaib, who's the head of the technical secretariat for the Partnership of Persons with Disabilities, my colleagues, Hannah Kuper from London School of Tropical Medicine, Marie, who is the co-founder and CEO of Scope, and my colleague Phyllis, who is also the director at the Office of WHO Ambassador for the Global Strategy. As I said, our discussion today is really to update you where we are in the initiative, open the space for discussion with you, and engage in the future afterwards. So our agenda very briefly is going to briefly remind ourselves of the interlinkages between disability and health. Also to update the participants on the implications of COVID situation on persons with disabilities. Discuss very briefly then why this matters for health system, what are we progressing on and what is still missing to be considered. Then we will have a brief action discussion, and then we're very, very keen to hear your voice as we go in the session and also at the end as well. And for that specific intention, we do encourage participants to really look at discuss through the link that we are sharing with you now through the Jamboard to hear your views and answer the questions. And as I said, it's a way of interaction along the session as we are speaking. I would like also to remind participants that we have captioning service available, and the link is available in the chat box for colleagues who would like to use it. Also, the webinar is on view only, but for participants who are keen to speak, please raise your hand through the Zoom link, and we would be ensuring to give you the space when possible. Without further ado, I would like now to introduce my colleague, Hannah Kuper, who will start the discussion with us today. Hannah, the floor is yours.
Thank you, Ola, and thank you everybody very much for being here today. My name is Hannah Kuper. I'm the Director of the Disability Centre at the London School of Hygiene and Tropical Medicine. And for the last 10 years, I've been focusing very heavily on doing research around disability, particularly access to health. And the thing that's really motivated me and inspired me is how much there is to do and how much impact we can make as researchers, because it's such a neglected area. And I hope that through this presentation that other people will also become inspired to see that there's much to be done and that your contribution can be extremely helpful at this time. Let's go on to the next slide. So when we think about disability, I'm an epidemiologist. I'm obsessed with numbers and classification, so we need to start with a definition. And the UN CRPD, the Convention on the Rights of Persons with Disabilities, defines disability in the following way: that persons with disabilities include those who have impairment, so whether that's a physical impairment, mental, intellectual, sensory, which can be visual or hearing, and that impairment in interaction with barriers, which can be environmental barriers, social barriers, attitudinal, means that those people with impairments are not able to fully and effectively participate in society on equal basis with others. So disability is quite multifaceted, that it includes both impairments and barriers, and the barriers can be broad, that limits participation. And the World Report on Disability, which came out about 10 years ago now, estimated that 15% of the world's population has a disability. At the time, that was 1 billion people out of the 7 billion people globally. So disability is extremely common. I can see that among our attendees, there are many people with disabilities, that all of us will be touched with disabilities in different ways. If we go to the next slide, so what we can see here, these are slightly updated estimates, which show that the number of people with impairments that often relate to disabilities is even higher than 1 billion. It's now 1.3 billion, given the population growth, and that these underlying impairments are very heterogeneous. So it includes people with hearing impairment, visual impairments, intellectual impairments, autism, spinal cord, cognitive impairments, and so on. So the underlying impairments are extremely diverse. It's a very diverse group of people. And then you'll see in the next slide that not only are the impairments diverse, but disability is extremely diverse. That people with disabilities includes men, women, children, older people, people living throughout the world, people with different sexuality and ethnicity and religion. And that disability is not the only defining feature of somebody, that there are many complicated, we're all complicated people with lots of things about us, but that on average people with disabilities face widespread exclusion. There's exclusion from education, from employment, there's higher vulnerability to poverty and violence. And that is very important to remember, that great diversity both in impairment and in experience when we're thinking about health, which is the topic today, and that we can't separate the exclusion from health from things like poverty and stigma, which are also very prevalent around people with disabilities. But today we're going to talk about health, and when we think about the health needs of people with disabilities, we need to think about it in 3 different ways. Firstly, on average, people with disabilities are more likely to experience poor health, and there are a number of reasons for that. The first is the underlying exclusion and marginalization, that if people are on average poorer and face discrimination and live in worse environments, they're more likely to have poor health. Secondly, people with disabilities by definition will have an underlying impairment and also a health condition which can further contribute to poor health, and that on average people with disabilities are older. So overall, people with disabilities on average will have a higher vulnerability to poor health, which means that they will need health services because of that. But on top of that, everybody will need regular health services. Everybody in the population needs vaccinations, sexual and reproductive health services, and so on. And that many people with disabilities can also benefit from specialized medical treatments or rehabilitation services. So that can be ophthalmology, psychiatry, assistive technologies, rehabilitation, and so on. So when we think about the health needs, we're really thinking about these threefold different needs, and that there's a diversity of needs that people will experience. But what we do know is we know now that people with disabilities make an enormous group, and that on average they're higher healthcare needs, but that across the healthcare system, people with disabilities often face additional barriers or issues in seeking healthcare. And what we see here is the healthcare seeking journey from deciding that there's a healthcare need to deciding to seek care, to going to the healthcare service, having the service, and then engaging in the treatment and follow-up, and that there are barriers across that healthcare seeking journey, both from the demand side, from the person with disability, as well as from the supply side, the healthcare workers. So things like lack of autonomy, lack of affordability, lack of healthcare worker training, lack of accessible infrastructure. And that these barriers don't come from nowhere. They can't come from that there's a lack of data and evidence, that there's a lack of legislation and policy to say that people with disabilities must be included, or where that legislation policy is in place is often not enforced. There is a lack of financing and funding put towards people with disabilities to make sure that there is accessibility and so on. And this all stems from a lack of leadership and management. Next slide. So we can think of some specific examples to demonstrate that. So in terms of affordability, the World Report on Disability estimated that 50% of people with disabilities around the world cannot afford healthcare. We know that very few medical curricula include information about disability. And as a result of that, doctors and nurses who have received no training about disability often have low skills or confidence to tackle disability-related issues. There's a lack of specialist workforce capacity, so lack of ophthalmologists, psychiatrists, assistive technologies, all across the world, but particularly in Africa. We know that many healthcare infrastructures are not accessible. So even in Germany, 65% of all German outpatient doctor offices are not accessible. And that although there's often gaps in legislation and policy, both in health plans or disease-specific plans that don't mention people with disabilities, or they don't make efforts to monitor or enforce the inclusion of disabilities, even when that is mentioned. And financing can be an enormous issue, so set against the on average greater poverty experienced by people with disabilities. Things like health insurance can be very important, but some health insurance schemes specifically exclude people with disabilities. So we really see the exclusion that's happening across the different aspects of the healthcare system. Next slide. And as a result of this, health outcomes on average are worse for people with disabilities. And in our Missing Billion report, we looked at this against the SDG 3 targets. And we showed that people with disabilities are on average 3 times more likely to have diabetes, 2 times more likely to be malnourished, 3 times more likely to die early. This is data from Africa. The World Report on Disability showed that people with disability are 50% more likely to face catastrophic health expenditure, that people with disabilities are twice as likely to have HIV or AIDS, 10 times more likely to be seriously ill as a child. And data from the UK showed that among early deaths for people with learning disabilities, in 40% of the cases, the health system was the reason for the early death. And new data shows that in Kenya, children with disability have a 4-fold higher mortality rate. So what we're seeing is because of these extensive barriers, there are very stark differences in health outcomes that relate to these SDG 3 goals. Next slide. And so if we think about this in terms of COVID, it highlights it even further. Next slide. So we know that people with disabilities have got a greater vulnerability to dying from COVID. So they are on average at higher risk of contracting COVID perhaps because messaging about protecting from COVID are not accessible, because people are reliant on care and therefore social distancing can be more difficult, because of inaccessible wash, because of people living in care homes. So for different reasons, they're higher risk of contraction. There's a higher risk of mortality from COVID among people with disabilities who are infected, because on average they may be older and also have comorbidities, and perhaps also experience worse care when they do get sick. And that there might be a higher risk of negative impact on health overall, so that we know that lockdown can have serious psychiatric and physical impacts, but that these may be even more extreme among people with disabilities, and that the lockdown and the impact on the health system has really impacted on routine healthcare that's available for people with disabilities, so caused worse health as a result. Next slide. So this is data from the UK, which I personally have found really, really shocking. So in England and Wales, 16% of the population are estimated to be people with disabilities. But the data shows that people with disabilities account for 59% of COVID deaths in England and Wales. So it's a very stark difference that really highlights why it is so important for us to focus on the inclusion of people with disabilities in health systems, and that must be done now. Even during a pandemic, when there's widespread healthcare needs, we still need to focus on this group. Next slide. And this is just looking at deaths overall, but if we focus in on people with intellectual disabilities, where there's more data, we can see that in this group as well, even among younger people with intellectual disabilities, the risk of death from COVID is far, far higher than for their age-adjusted peers without disabilities. So it can be between 2 and 11-fold higher risk of death. And that if we think about it in a different way, we're looking at COVID and what are the biggest risk factors for death from COVID, we see that of the top 10, half of them are related to disability. So the top one is people with developmental disorders. The likelihood of death is the highest. Intellectual disabilities, spina bifida, Alzheimer's disease and dementia and mobility impairments. So the data is showing us again and again that people with disabilities are experiencing far worse health outcomes. And that's just in terms of death, but we also need to think about the quality of services. So imagine that you are a person with dementia and that perhaps you've been living in a care home, perhaps you've been at home and you become sick from COVID and you're moved into a hospital, and all of the usual props, all of the familiar things for you, the people, the house, everything is taken away. And you're sick, and it's the people, the doctors who are caring for you, perhaps are not really able to explain in a way that you need what is happening for you. So it's not just about mortality, it's also about the quality of care that you might experience as a person with disabilities in these times that we also need to tackle. So what we're really talking about is equity. We're talking about equity in access to healthcare. We're talking about equity in access to healthcare also in the time of COVID. That this is not something that we can do later when there's healthcare in place for all, but that it's something that needs to be fundamental as we build health from the start. And as we're moving into the next phase of the COVID pandemic, where we're thinking about vaccine rollout, we really need to think about access for vaccines for people with disabilities who we know are so vulnerable, and how that can be integrated into our response in a meaningful way. Next. So at this point, I'm going to hand over back to my colleague Ola to continue. Thank you.
Thank you, Hannah. Thanks for providing us or reminding us of the broader implications of missing access to health in general on persons with disabilities, but specifically in difficult situations as we are facing this year, of the additional implications and risk that persons with disabilities are facing. Before I start my input, I just wanted to share with the participants why this initiative is really important to me as a person. As you know, I am the director of the technical secretariat for the UN Partnership of Persons with Disabilities, but my personal experience, backing my professional one, has been always a reminder of the implications of the failure of the health system on the person with disability. I had my disability when I was 14 due to a mistake after a surgery. I woke up from the surgery losing my ability to walk and to use my right hand. And since then, I can see how being in Palestine at my first early years of living, it was really a struggle on daily basis to protect myself from getting into further health implications, because the health system wasn't ready, and still unfortunately in Palestine is not ready to welcome a patient with a disability, because there is this assumed divide between health system more broadly and the needs of the individual once they have the onset of disability. So that's assumed to be rehabilitation, physiotherapy, access to assistive devices. On that side, there are also many challenges, which we mentioned in the Missing Billion report, which are related to affordability and availability. But also in the broader health system, just needing to go to a doctor if you have flu, or when I was pregnant, just going to a gynecologist, finding an accessible bed for examination, all of that was a struggle and continues to be the case. Believe me, now I live in New York, and I can see still the challenges facing me of accessing broader health services, because it's not always the case. Yesterday, I went to visit a hand surgeon, and I was told that the clinic is accessible. When I went into the door, there was a step that was 20 centimeters height. I couldn't get with my chair. And even though I did tell them when I took the appointment that I'm a wheelchair user, they said, yeah, we're on the first floor, don't worry. They just didn't take an attention of the step. So this is again a reminder to us all that the inclusive health system need to have this broader understanding of what needs to be in place. Otherwise, millions and millions of persons with disabilities will continue to have less impact of available services and limited access to what needs to be in place for them. Now, this is a reminder of the importance of this initiative. Next, please. And that's why we really came along together to understand why. Why are we still missing the boat when it comes to disability within the broader health system? Despite the fact that, as Hannah said, from the angle of disability, there was a massive reminder 14 years ago that health is an essential right for persons with disabilities to help them access the broader services. But also 5 years ago, even more explicitly within the SDGs than the MDGs, there was a recognition globally that there has to be equal access to everybody, including the Leave No One Behind, which has the categorization of looking into communities with disabilities, which we know that the failure of that will have implications on well-being, disrespect to the global frameworks, limited access, and further implications of enjoying independent living. But the picture is still not very promising. Next. What do we see from the evidence that we have been looking at the global initiatives that are looking into the global promise of implementing SDG 3? We can see from the evidence you can see on the slide that even the explicit mentioning of disability in broader global action plans related to SDG 3, collaborative efforts of networks looking into it, UN resolutions, declarations of the health ministers, still it's an ad hoc, not systematic recognition of disability. And that's why, unfortunately, if this remains the case, 10 years from now, meeting the Leave No One Behind the agenda on achieving equity when it comes to SDG 3 for persons with disabilities will not be met. And still, we will be having the same discussion we're having now, that persons with disabilities were left behind when it comes to what was promised for them to have equal access to health services. Next. So that's why we have been really trying to think, based on our own experiences in our own organizations, we know that the reality is very hard. Something needs to happen. And this collective effort brought the different expertise of us as individuals, but also as organizations to see what needs to be in place. And of course, the main essential thing is governments. Governments are leading health systems, but they need more support. They need to understand the gaps when it comes to disability inclusion, but also they need the tools to understand how to take action when it comes to that. So that's the one key pillar of the work this initiative is looking at. But also, health actors and funders also need to understand the practicalities, needs to understand what works, need to have deeper capacity building and technical assistance of the step-to-step guidance on what they need to put in place. But also one missing piece on the broader disability inclusion widely, but also even more importantly, when it comes to health systems, is innovation. What is really working? What can be really done in sometimes limited incomes settings that can work? What can work in the health system when it looks at diversity of need within the disability community? So that is needed, and that is a pillar that we will continuously, hopefully, continue to advance and work on. And the last and equal important element is the joining the global advocacy around the importance of the issue. Our gathering today is one key essential point of that. We need to keep the word out there, to provide further evidence, to advocate for a quickest change possible, because the realities on the ground, as we can see from the pandemic, as Hannah mentioned, unfortunately, people with disabilities are losing their lives. It's just a limited, implications on the individual. So this has to change, and hopefully our initiative, along collaboration with others, will make a difference. Thank you. And now I hand over to my colleague, Phyllis, to start her part of the session.
Yes, hello everyone. My name is Phyllis, and I work at the Office of the WHO Ambassador for Global Strategy and lead community health work there. But I'm also very much involved with the missing billion topic. In 2019, I was lucky enough to work with Hannah Kuper and others on the missing billion report. And being in healthcare for most of my professional life and being a health economist, but also even the sister of an incredible brother with intellectual disabilities, I have to say the results of the missing billion report were a really big aha for me. It was a surprise to learn about these health outcomes. And my professional career is committed to equity and health systems. So it is really important for me that we work on the discoveries we made in the missing billion report. But now let's talk about action. First of all, we wanted to share with you this basic structure of a health system more as a way to organize our comments and as an organizing structure. This is a somewhat general health systems framework, one that we adapted from the Primary Healthcare Performance Initiative, and we're using it, as I said, as a organizing structure, and is something that can maybe help break down this really big problem that we're presenting around the missing billion. In the context of this framework, we have here a number of what we call must-haves for you included. These are things to think about more as levers for change that we and many other experts in this field have identified. So I'll name a few, and maybe that gives you some sense of really what can be also practically done in health systems and in health systems work. On governance, countries have to translate international laws into country level laws and policies, and then importantly, translate that into national strategies and disease strategies. They have to include measures to protect the right of healthcare services for people with disabilities. Ministries of health, we all know how important it is to have accountability, roles and responsibilities for different topics in ministries of health. And equally, the disability topic has to be clearly represented in a Ministry of Health. Hannah spoke about health financing it is important to have measures so that health financing or health insurance coverage is available and the benefit package is comprehensive and doesn't discriminate. More specifically for the health financing members here in the community, maybe there's also important adjustments that have to be made in the way providers are reimbursed to account for this, for the challenges we're seeing. Most importantly, maybe even an underlying thing is data. We lack data to further describe the issues we're seeing and understand the root causes. Often routine, or for the most part, routine healthcare data is not disaggregated by disability, and that's a very important basic change and must-have that a health system has to deliver. On the service delivery side, equally here, a few levers for change. People with disabilities must be able to make their own decisions. People with disabilities must be able to afford healthcare services. Healthcare workers have to be knowledgeable. Healthcare facilities have to be accessible, and quality specialist services need to be available. Now, these sound for a health system person pretty straightforward things, but behind each of these is a whole range of complex issues, wide gaps in evidence, lack of innovation, and most importantly, really big gaps in delivery. And that's why we see the outcomes, the health outcomes that Hannah was describing before. So we all know, most of you in this webinar are doers and movers and shakers. So we would like to suggest to you 3 ways for how you can take more specifically action. First and foremost, of course, learn, read the Missing Billion report, but also other important literature to assess your own processes and your own work against this topic. Then, absolutely most importantly, consult people with disabilities, learn from their experience and from the ongoing work that they're doing. You can also consult, of course, technical experts, and then start making changes, prioritize a few issues to get started with that either ensure that your existing health programming is inclusive, or you consider targeted programs in specific areas. It's important to train colleagues and to make these investments, and then use your voice, advocate maybe with us together with the rest of the healthcare sector. You can also take action by collaborating with the Missing Billion Initiative. As Ola has mentioned, the idea is to continue to advocate with the health community on the importance of this topic and to take action. But we're also building a number of foundational tools that will allow governments, hopefully, to make changes, important changes, as well as donors and implementers. So we're building a diagnostic toolkit at the moment for our Ministry of Health counterparts. So you're very welcome to join that work. It will also include a best practice compendium. So if you're working already on this topic and you have good practice examples to share, we would love to hear from you and include them in the best practice compendium. We're working on a checklist for mostly funders to review their existing health programs against these different disability dimensions. So if you're interested in working with us on this, please get in touch. Specifically for health funders in the HIV space, we're working on an HIV toolkit, so that might also be something that you want to support. We'll say a little bit more about in our innovation work, but we're planning some innovation work in a number of areas this and next year. So if you're an implementer, join and partner with us on these projects, or you can help fund some of the innovation platform that will allow to do this. And then we're planning to continue to advocate for this topic and engage the health community. And we would love for you to add your voice with us, talk about the issue, and if that is your area of focus, if you're a funder, invest in social mobilization and movement building. And with that, I will hand over to my Missing Billion colleague, Marie.
Classic. I was muted. So thank you, Phyllis. So my name is Mari. I'm the CEO and co-founder of Scope. And I've worked in global health for the last 25 years. But it was only recently, about a year ago, when I, as part of my own sort of personal disability learning journey, was connected to Phyllis, Ola, and Hannah, and the Missing Billion report, that I really sort of had that same aha moment, maybe that you, Phyllis, had, sort of reflecting on how neglected or how much at the sort of periphery of all the work that we've been doing, or that I had been connected to, the people with disabilities had been. And so through that and my personal interest, that sort of propelled me to then join forces with my other colleagues on this call. And so I'm the Missing Billion lead on innovation, and we all know, and we mentioned them on this call, the sort of gaps that exist in best practices, in quality services and sort of delivery models. And we want to move us forward faster in this area, and are building up an sort of acceleration program, which will, together with people living with disabilities, ministries of health and partners, and the innovation ecosystem that isn't really very focused on this issue either, co-design, test and scale new solutions. And we'll focus on 4 areas: discovery and opportunity mapping. And we'll build up a set of sort of global goods, deliver on our own innovation projects, starting with a focus on community health workers and sort of primary healthcare. And then also we're seeking to sort of launch open challenges. The other area that we're also working on, the advocacy part, maybe I'd like to just perhaps present or talk that through a little bit through a sort of more personal lens as well. I'm the mother to Maya. She's 13 and she's disabled, and I've engaged her in this work from the very beginning. And she's interested, but we always end up at the sort of same point, including yesterday when I was talking to her about this webinar. And she always says the same thing, that this is pointless, that don't waste your time, and that nobody cares. And that's her experience, of course, but I would like her to know, and others to see, that that's not true, that there are a billion people who care, and millions of colleagues and friends, family that care, and you're on this call, you care. And so how can we capture and make that support that exists more visible, and sort of showcase also the work that's ongoing. And so we asked that at the beginning through the JAM board, how can we, in a way, supercharge this movement, capture that energy, and sort of focus it on very targeted advocacy work. And so maybe we'll just turn to that JAM board quickly to see what you've shared with us. Hopefully we'll manage to do that. So there are a few sticky notes here. Maybe I could just quickly glance through. So thank you for sharing those. Some of the examples or some of the notes that you've shared here are really about having sort of collecting better data, having perhaps a more compelling narrative. We need mindset change, and sort of tackle the stigma, organizational champions and influencers to take on this topic. Thank you for sharing these. We'll sort of connect these into our work and weave them into our planning. And we'd also like to say that the Missing Billion really is a sort of collective platform for all of us. And we know that there's a lot of work ongoing already. And so we hope that this is a forum through which to sort of share, learn more about and build on the work that's already ongoing. And so we'd like to sort of end in a way with an open call and an open invitation to all of you to sort of connect to us. And those of you, while my colleagues, I think, will be able to take some questions, perhaps if you had the moment or a few seconds to spare for us to kind of fill in a poll that we'll have here soon, just to make sure that we can be as useful to the community as possible. And so if you don't mind filling this in as well, that'd be lovely. And from me, I'd like to say thank you. Over to you, Phyllis and Hannah and Ola.
Great, thanks so much. I think we have time for a few questions if people have some. So I don't know, Danae or Sarah, you've tracked questions. Are there some that we maybe want to discuss in a forum, or people can raise their hand if they have questions that they want to ask?
Yes, we have a question here from Susan. She's asking, can you please give your contact information for those who are working as implementers?
Yes, we can write in the chat all of our contact details.
We also have a question from Laura Dominguez. She's asking, are there also plans for a checklist for implementers versus donors?
Yes, so we've recently developed a checklist on specifically to do with WASH, which was related to FCDO work to make sure that hygiene and behaviour change and WASH programmes are inclusive of people with disabilities. And we do have plans for adapting that for health programmes, so that implementers should be able to check to see how they're doing, where there are gaps and where there are areas for better work and improvement. And anybody who wants to join us on that, you're very welcome. So I think that this is one of the things that we want to say in this webinar, is that we're very passionate about this topic, as you've heard. We are small in number, and we welcome anyone to join us and share your passion and experience.
So if there's anybody else who would like to comment or ask a question, we can take those now.
So there's another question here, which is in the Jamboard, about how can we unite so many people globally who are working independently to collaborate? And I think that that's a really excellent question, that there are people within the disability movement working on health and people within the health movement working with disability. And what we're trying to do is pull people together, but we'd really welcome your thoughts about how we can do that better and provide a forum for that.
We have another question here. So how do we write the SDGs while simultaneously we're all working towards them, as well as World Health Assembly 2025 goals, gain traction on financing, national ministries, inclusion of disability, etc.?
And I think that goes with another question that's gone on to the Jamboard, which is that at the moment, these topics are seen as nice to have and not essential. And I think those two issues, so within the SDGs, a number of them have got targets, indicators specifically related to the inclusion of people with disabilities, which is in education and employment, but not in health. And so at the moment, those two things aren't linked. And I've had several conversations with ministries of health where they've basically said things like, we will address the issue of lack of healthcare for people with disabilities once there's basic healthcare in place for all. And I think what we're trying to encourage people to say is, if you plan for inclusion from the start, it'll be much more effective, but also you'll create better health systems that serve everyone better. And I think this is something that we're really struggling with, and we have a very varied number of participants. And so we'd also welcome your ideas about how we can make this more central, the issue of disability, both as we're trying to achieve UHCs and SDGs and other World Health targets. So I don't know if there's an opportunity for attendees to also speak, because that would be great.
They can raise their hand, yeah. Maybe just all to say, I'm not sure if the question is more referring also to balancing different aspects of working on disability. All to say, obviously, we come from the health sector. It is really important for us to work with our peers in the health sector on these disparities. But as Hannah also talked about in the beginning, there's a whole range of challenges and complexities, but we're trying to tackle one particular part of it.
Yeah, we also have another great question here. It says, are there any win-win stories where design for equity also means just better design and investment in general?
So I think perhaps Marie can reflect on that with her great experience in designing for equity. You're on mute.
Can you repeat that, please? The question, please.
It's about, if you design for equity, how can you show that that just produces better services overall, that it's win-win?
Let me take a sort of very practical example that I saw yesterday on JSK's sort of a design summit, where they designed a sort of specific cap for bottles for people with disabilities, with arthritis, and sort of under this kind of umbrella of inclusive design. And as actually it's proven that it's much better and easier for everybody to use, and they're now rolling that out as a general product. So we've seen that in some of our other larger programs where we've improved the experience of care and sort of space, product and services holistically in a facility. And we're happy to share some of those examples that we can pass along after this. We have sort of externally evaluated programs that show the outcome.
And just to say, I think that in the health sector specifically, obviously the question around money will be important. How much does it cost to adjust services? Hannah's always making the point, if you were starting from scratch and you would start to design services inclusive of people with disabilities, it wouldn't cost more and it would make them a ton better. But unfortunately, of course, we're not in that situation. So there will be a question at some point about the health financing component of that, and something that will have to be explored as more activity happens on making these adjustments and bringing in innovation. But I think there's a whole much bigger body of work around universal design that many disability experts and designers can speak to, and there's a whole range of also very compelling data, not only the one that Mari just mentioned, but I think people have also really tracked increased revenues when they had products designed that had the universal design approach. Great. Any further questions or comments in either Jamboard or chat? Great. Otherwise, maybe we will close and end by thanking you all for giving us your time and important attention during times when everyone is very busy and there are too many Zoom activities. So we're grateful for your attendance, and we hope to hear from you and continue to work on this topic in collaboration with everyone.
Thanks, everyone. Bye-bye.
Thank you from Helsinki.